Welcome back. We are tracking an urgent health alert this morning as a fast-moving parasitic outbreak spreads across Ohio. State health officials just confirmed nearly 400 cases of cyclosporiasis across 57 counties, and it has already sent dozens of people to the hospital. Right now, Franklin County is really the hardest hit in central Ohio. The infection is typically tied to contaminated food or water, and it can cause severe stomach illness that can last for weeks. Columbus Public Health Commissioner Dr. Mysheika Roberts is here. We're really glad that you could join me this morning. Thank you so much.
Happy to be here.
I wanted to talk about this surge because we seem to see it spreading in real time across the country and here at home. So give people an idea of what's happening.
So first of all, cyclosporiasis is a parasite that we're very familiar with. It's been around for a while. We typically see cases increase during the summer months, usually like May through September. We did have a large outbreak that Columbus was impacted on in 2023. And the source of that was never identified. That particular outbreak, we had about 40 cases just here in Columbus alone. So again, this is something we're familiar with. And the good news about this is there's treatment for it.
Yes.
So if you do get symptoms, you do get sick, if you go seek care from your healthcare provider, they can give you an antibiotic, and that will help you feel better and reduce the time or the duration of your symptoms.
And when should you go? Because I know the headlines have been exploding diarrhea, but I mean, can you go before it gets to that point?
Well, yeah, I mean, you should go whenever you start feeling uncomfortable. So, you know, symptoms not only include diarrhea, but you can have nausea, vomiting, you can have stomach cramps. And so if you experience that and it's uncomfortable, you should definitely seek medical attention. And if you do get the diarrhea part, which can happen about a week after you were exposed.
Okay.
That's why it's been a little more difficult to pinpoint what the source is, because how many people can remember what they ate a week ago?
Right. It's hard to remember what I ate yesterday.
Yeah, exactly.
So let's talk about how it's spread. We've been hearing a lot about concern about the pool. Talk about the pool safety.
So pool water is not a typical source. It can be, but that's not what we've seen in recent outbreaks. You know, if your water is chlorinated and if you have diarrhea, you should not be going to the pool. But we usually see this spread by food, not by the pool. So it's hot, continue to go to the pool, but wash your hands before eating. Don't go if you have diarrhea, all the stuff we talk about all the time.
We got some questions from viewers, including one who asked about washing your produce with baking soda.
Yeah, that's something I'm not familiar with. I don't think it should hurt as long as you rinse it off really well from the baking soda. What we typically say is make sure you scrub your hard surface produce, whether that's a fruit or a vegetable. You know, the one culprit that has been in the media is lettuce. And lettuce is often implicated in a lot of outbreaks. And I'll be honest with you, lettuce is hard to clean. Because usually when lettuce is infected with a parasite or bacteria, it's usually in the veining of the lettuce. So it's how it was grown. And so it's really hard to get that out. I'm not telling you not to eat lettuce at this point in time, but it's something that we're mindful of. And it is hard to remove parasites or bacteria from lettuce by washing them.
All right, and as we close, you also hit on something that we talk about all the time, hand hygiene.
Hand hygiene. Wash your hands all the time after going to the restroom, before eating food, before preparing food. That should be a staple. We should all be doing that even after the pandemic, but we should all be doing that every single day, every single meal.
All right, Dr. Roberts, thank you so much for coming in.